Hello and welcome to another episode of your AKT Podcast, which is hosted by WellMedic.co.uk. In this scenario, we will drift away from clinical biochemistry to another familiar topic in dermatology. Now, dermatology can be tested in a number of formats within the AKT, so it's important to understand descriptions as well as the pattern recognition of images. Now, I'd be very surprised if anyone listening to this podcast has not suffered from a form of acne, and many of us are now actually suffering the recurrence of acne in the form of maskne. Now, the question for this scenario is that a 14-year-old Bangladeshi boy has been suffering with acne for 2 years. He has widespread open and closed comedones to his face, his neck, his back, and his chest. The patient has noticed that his acne is actually looking angry, and as a result of this, he has started to wear his school gym clothes under his uniform on the days that he has PE. What would be the most suitable treatment regimen for this patient? Now, the key to this scenario is really to demonstrate an understanding that although acne treatment follows a ladder or a stepwise approach, the severity of the acne and the psychological impact can often influence the treatment choice as clinicians. Now, the PCDS, which is the Primary Care Dermatology Society, uses a number of images to help differentiate or demonstrate the different treatments based on the image severity. Now, comedonal acne alone will often begin with our first line treatment, which is often a topical retinoid in adapalene, which is often followed then by a combination topical agent. So combination products include Epigeo, which is adapalene plus benzoyl peroxide, or Duac, which is clindamycin plus benzoyl peroxide. Now, it's very important that when we use topical antibiotics that they are in a combination preparation, because you're trying to reduce the bacterial resistance that may be present. Now, the big issue is compliance with acne products, and that's in all acne treatments actually. So informing the patient of that localized irritation or burning that may occur due to the products is really important. And also from a kind of parental aspect, it's important just to mention that they may stain the pillowcases as well. Now, in our case, we have a child who has fairly widespread acne, which is having a significant impact on his school life. And for this purpose, it would be entirely reasonable to actually step up that ladder without using some of the topical treatment and go with oral antibiotics. Now, the first point to remember with oral antibiotics is that you should co-prescribe a topical agent. So ideally speaking, you should go with benzoyl peroxide because this helps to reduce the risk of bacterial resistance. Now, first line antibiotic choice is usually a tetracycline, and most commonly it's 408 milligrams of limecycline once daily for 3 months, but you could also go with doxycycline daily for 3 months as well. Now, macrolides should generally be avoided due to the higher levels of resistance in the bacteria, which is P. acnes, and I apologize for not mentioning the real or whole name because it's a real mouthful. Now, another reason for more aggressive treatment in this scenario could be as a result of the patient's ethnic background. Now, it's often a misconception that acne is more common or more severe in patients with a pigmented skin tone. Now, the key thing to remember is post-inflammatory hyperpigmentation can often be a very significant problem, and it tends to persist for many months to many years. So that early aggressive treatment is often advocated, and there also is kind of a push to have early consideration of oral retinoids in this scenario as well. I hope you found this helpful. Thank you for listening. This podcast is hosted by wellmedic.co.uk. We help GP trainees pass the AKT.